34 years, thousands of patients, countless lives touched, directly and indirectly. Welcome to the Corridors Podcast KE. Today we sit with Nurse Kahara, a nurse whose hands have healed, taught, and guided so many through the years. As she prepares to step away from the profession this month, her story reminds us what it truly means to dedicate your life to care. Say a good morning, good afternoon, and good evening from wherever you're watching us from. This is the Corridors Podcast, and this is Dante for you. If you've been watching us, you already know you have to hit the subscription bell, and you have to make sure that niaje your bell iko on, because one, we will be dropping episode each and every day for you during this period of Nurses Week, and we are celebrating a nurse in a different way. 7 days, 7 stories with 7 nurses. You're welcome on board, and today we are sitting down with Nurse Kahara. I'm extremely excited to have this conversation because this is a nurse who's been here for over 3 decades now, and she's seen it all through care. And keeping in mind that she's been in front line of care, every nurse out there is always giving at least 60% of their life to giving care. And today, I will give her all the opportunity to mention her name. And to those that know her differently, she is a mother, right? Yes. And she is a professional. But I know there are other things that possibly she does past the uniform. Welcome on board.
Thank you very much.
Yes.
Yes. I'm privileged to be in your program.
Welcome.
Yeah. My names are Aris Nyamura Kahara. Mm-hmm. And as you have said, I'm a nurse by profession. Now, when I talk about nursing, I normally say I never liked it.
Uh-huh.
I didn't know much about it.
That's the serious bombshell around it, huh?
Yeah,
because
sure.
now you mentioning that you
I didn't like
that for
it.
you is quite a long time.
Yeah.
Mm-hmm.
And, during our time, mm-hmm. that is in the 70s, 80s, mm-hmm. we didn't have the privilege of choosing anything.
Okay.
So after completing my Form 4, now my dad comes one evening and tells me there's a school that you are supposed to attend in Ukabani, mm-hmm. and that is nursing.
Okay.
Well, anyway, I had to go. Because initially I wanted to take dressmaking and designing. Mm-hmm. I love knitting, even up to date.
Okay.
But it seemed as if during those days that was not a career. Mm-hmm. It was not a reputable thing. Yeah. So I fell for the nursing, and once I stepped my feet in that college, mm-hmm. well, I took a new turn and loved it all along.
It was a private college?
Yes, it was a Catholic mission.
It's still...
it is still there, even
still
today.
There. Training nurses?
Yes.
Now that it's a Happy Nurses Week, mm-hmm. I just want you to take like 10 seconds, 20 seconds to wish them a Happy Nurses Week before we proceed.
Yeah, from Alice here, I'm wishing all those at Mutumo Mission Hospital in Kitui Central, a Happy Nurses Week.
Okay.
Yes.
Anyone who was trained through Mutumo, anyone who's still undergoing the training around there, feel tagged, feel loved, and we celebrate you.
Yeah, we are also a few of us here working in Pumwani from the same college. We've been many, okay, but have been retiring, mm-hmm. day in, day out.
Some that maybe you could mention?
Yes, I have Rusingari, okay, who is retiring with me. I have Sarume Mukui, who apparently is my secondary school mate.
Okay.
And Janita Soba, who left last year. Mm-hmm. Yeah, and many others that have left in the past years.
Nice. Yes. Happy Nurses Week to them.
Yeah, Happy Nurses Week.
They say that you will be a nurse until you go 6 feet down. Do you agree to that?
once you undergo the training, you get transformed. If you love it, there you are. Yeah, you become a nurse.
Okay, you become a nurse.
Yeah, but you must develop passion, because our day in day out hustles in a hospital.
Yeah.
They are not that very comfortable.
Okay.
So you must develop some interest in it.
Exactly.
And as the years go by, you not only perfect in what you do, but you come to realize that you need to do what is supposed to be done as a nurse.
Okay.
You have to love it.
Yeah.
Yes.
Nice. Today I'll be doing much of listening more than talking. You know, when someone tells you that I've been in practice right now is 5 years.
Okay.
And I feel, I know, someone might not have mentioned, but I feel a little bit exhausted with the 5 years.
5 years already.
Yeah, 5 years of exhaustion in nursing care. And, when we mention 34 years, what does it really mean to you, having practiced and, served for 34 years?
Now, 34 years in nursing means transition from different phases of life,
Yeah.
meeting technologies as they advance.
Exactly.
When I went to college, I remember there used to be one fetal Doppler that was only handled by the doctor. Nobody else could handle it. Just one in the whole hospital.
Wow.
And now, as years have gone by, now we have Dopplers. Each nurse has a Doppler.
Each nurse has a Doppler.
Yeah.
Even students have their own.
Yeah. It's no longer that very special, that very unique item.
Yeah.
We have worked all along with the manual BP machines.
Yes. The one with the mercury, yeah?
Yes.
Yeah.
Up to a point that if you ask me what I would go for, I would still choose the mercury. Yes.
It really gave me problems before I got used to it.
Yeah, you have to get used to pumping and aligning the mercury, because if there is space between the mercury, then it will not give you any good measurements.
Exactly.
Yeah, but it has the best.
And they say
results.
It's the most perfect one.
It is perfect. Yes.
Nice. So we have several companies that sell these equipments. I would like to, mention them out now that you brought the mercury blood pressure machine. There's one Caltech Supplies. Caltech Supplies deals with hospital equipments, and they supply each and everything someone will need. The theater supplies, if you want something for MCH care, that would be if someone needed beds, hospital beds, the reclinable, all those blood pressure machines, thermometers, and everything else. And they've worked closely with us. We appreciate them each and every day. They still sell the equipment up to today.
Yes.
The mercury one.
Yes. They are still there.
Yes.
I was watching a documentary. There was this physician in Germany.
Okay.
And he was saying that is what he uses, the mercury blood pressure machine. To him,
but they're not easily on the market right now.
They are not, but you can't miss one here and there.
Okay.
I think the Rista company still have.
Up to today?
Okay, we don't have because they have been overtaken by events, and I think the hospital is also not procuring those. The only one I had started leaking mercury, and now it could not work anymore.
Okay.
Yeah.
Okay.
But you can fight them, 1, 2 here and there. Yes.
Fine. Now, being in practice for this period of time, which department have you practiced in for the longest period of time? I believe you've been in an accident and emergency department, right?
Yes.
In a theater. right?
Yes.
You have worked in MCH.
Yes.
You have worked in Alebod maternity wing, right?
Yeah.
You have worked in a pediatrics unit.
Yes.
Amongst these ones, which has been the most, craziest of all, if I could maybe lack the better word to use?
Well, if you talk of accident and emergencies, you are handling emergencies as
Yes.
per se.
Yeah.
And I've been in the government longest.
Okay.
I practiced in the private sector for only 2 years. Then joined the Nairobi City Council then. That was 1991. I remember I worked in a mission hospital and I was in accident and emergency room. Well, it's not very inspiring because you are running up and down
Yes.
throughout.
Yeah, exactly.
Yeah?
Yeah.
But all in all, you get to know a lot about resuscitation
Exactly.
and
And
saving lives
Yeah.
entirely. Yes. Yeah.
Fine. And okay, fine. That was on the most critical part of
Yes.
care. A department that you've worked in, and if you're, someone wakes you up at 3 a.m., you'll still be happy to go back to the department and appreciate working in it.
Now that is the maternal neonatal child health and family planning, where I still am. I've worked in that department longest. I've headed the family planning services for a very long time.
Okay.
I was there when we used to train the community-based distributors of contraceptives. Yeah, I'm a community health promoters trainer. Actually, recently in early March, late February and early March, we've trained around 550 community health volunteers within Kamukoji.
550.
Yes.
That's a huge number.
Yeah.
In healthcare.
On nurturing care. There's a new concept being brought by AMREF on nurturing care. This is the play program in early child development. In fact, we call it ECD. This is a program that we are teaching mothers how to start nurturing a baby in utero.
Okay.
As the baby is born and up to 5 years and beyond. And what we are encouraging here is simply the play.
Okay.
Play ni kucheza. So we are calling this program Tucheze Tustawi.
Tucheze Tustawi.
Yes. Number one, our goals, we want to remove all babies below 3 years from the screens. Yeah, from the gadgets.
That's perfect.
Yeah.
That's perfect. If
And encourage play with family members and even the parents with homemade items. If you come to MCH, you'll find a lot of play items handmade. We have a corner for them.
Okay.
You'll even find us playing around with the babies, with balls, with the small ones below 6 months, 8 months. We are showing them these bright colors. They identify objects with colors.
That is from 5 months?
From let's say 6 months and below. So we show mothers how to make a bottle, put in very colorful, shiny objects, and place it on the baby's eyes, and you find the baby following, making jingles. Jingles you make with the pegs. Number one, you put a bottle, put some pegs, put some beans, some dry maize, as long as they can make noise.
Okay.
And these items are locally available. We don't want anything from the shops. We even make cars with the cartons, boxes, and show them how to play. This play has to be organized.
Okay.
We train the caregivers and even the bigger children or the family members how to utilize those play items and how to program the play at home. Yes.
You said, what was your interest again before going to a nursing school?
Dressmaking and designing.
I believe you're still designing.
Yes, I
now.
design my uniforms.
You design your uniform?
Yes.
Interesting.
Yeah.
Interesting.
And
you're still doing...
I love knitting. I knit a lot. Sweaters.
I feel you're still doing it up to your level at work. Because
Yes, I do it very much.
If you guys are, if you said you're a trainer and having gone through training the caregivers on how to make at least jingles and all that, that's all designing.
Yes.
And interestingly, someone will never run away from their destiny.
Sure.
You will never run away from it. We all agree, right?
Yeah, that is my passion. In fact, my mother had identified my interest in knitting. And back in those days, I come from Central Kenya.
Yeah.
So we had home science programs, and we would knit. So during competitions, the headquarters of Central was in Nyeri, education headquarters was in Nyeri. So I would be appointed. We were 3 girls. We would stay in a room and knit. Knit sweaters, this one was very good in making skirts.
Okay.
And this would be taken for the competition. And they would really win and come back with the trophies. Yes.
Nice.
So out of that, and I think it was just, nobody taught me. It was just a reflex, I can't remember anybody teaching me how to knit.
Trying to merge all the patterns from one to the next and all that.
Yeah, I was only guided. My mother used to guide me.
Okay.
And it so happened that even today, I knit. I can use the YouTube tutorials. And funny enough, it's not necessary for me to knit as I'm reading. I can read and decode it. I've never understood that. I read and understand that pattern, and I knit.
And that is it?
That's it.
Interesting.
Yes.
Okay. Taking you back to nursing a little bit. Has there been a baby you saw when you were getting into care? And now they are, I believe you've seen many who are 30 years, 32, 34 years now.
Yes.
Some are 28, some are 2018. But the eldest of them all, that maybe the parent met you someday and introduced you that this was your nurse.
Yes.
Is there any?
Actually, recently, not long ago, one of my colleagues, by then, I delivered her a baby.
Okay.
When I was in Langata, I think. Langata Health Center.
Langata Health Center.
Yes. The other day, she brought that girl here for antenatal clinic. And I brought her to labor or to deliver. And I wanted to deliver her, but now she did not go, she did not progress on rapidly. So I had to go home. And I found that she delivered that night.
Over the night.
Yeah, but I took her through antenatal clinic.
Possibly you would have brought 2 generations.
Exactly. And you feel good. It is not something that you just come across day in, day out.
Yeah, that's grace.
Yeah.
Yeah, we call it grace from, God and all that.
Yeah.
Because for someone to bring the first generation and then you meet this lady that you held in hand when they were 1 minute old. And then now they are bringing another life. Again. You've attended to this mother through the antenatal care until the last minute of delivery, and you're still there closely with them. Yeah, that's so interesting.
Yeah, it is.
Yeah.
I found it quite something to keep remembering.
Okay.
Yes.
The minute where in your care you felt maybe disappointed in your giving your skills out or supporting your staffs or working closely with them, has there happened that there was that minute where you felt you had lost it all in nursing care?
Well, let's say when I'm not able to help a client,
Okay.
especially during this era of financial crisis,
Yeah.
we have this street community, and I used to work in the community. I'm a community resource person, so I work at times in the community,
Yeah.
and you find that these people cannot raise that money to buy
Exactly.
that drug.
Yeah.
And here they are, and there's nothing much you can do. At times it hits me hard, because most of the time I'm not also able to help financially.
Yeah.
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 And now you see, like, you are losing it all.
Very true.
Yeah.
Mm-hmm.
Actually, what I do with my colleagues down there, we normally ask our clients, especially the young generation giving birth, to give us old clothes. And these old clothes, we keep them, such that when we have this street community or a desperate client, we give them. And it touches us very much when you have one now you can't give, you have no clothes.
Okay.
Yeah. When you have a client and there's nothing much
You
can do,
Yeah.
now it becomes a challenge.
Okay.
Yes. Yeah.
That's so touching, eh?
Yeah,
Because
it really disturbs.
it really disturbs.
Yes.
Yeah. I listen to you, and I get this word, which is client. You mentioned client several times,
Yeah.
and you attend to mothers who are specifically, let me say, antenatally.
Yeah.
Right? Antenatally, would you say there's a different argument before I give you my point of view? Would you say that pregnancy is a disease?
Well, as a midwife,
Yes.
the long-term one,
Yes.
I know that pregnancy is not a normal thing.
Yes.
Okay, people term it as a normal occurrence which everybody has to experience. But no, pregnancy is a complicated science that has to be dealt with well. Because a slight mistake or a slight delay, we could lose more than one life.
It doesn't take long. It never takes
It doesn't take long to lose. So every mother should be termed as a high risk. Yeah?
long. Exactly.
Our clinic here, we have a high risk clinic where we get all the mothers from Nairobi and its environs, not necessarily Kamukunji now.
It's one of the best, you work with one of the best hospitals in East and Central Africa in maternity care.
Exactly.
Yeah.
Yes.
Nice.
We are also leading in Kamukunji
Yeah.
in 8 antenatal contacts.
Okay.
Because we have the new antenatal program. We are no longer calling it the FANC, Focused Antenatal Care. Now we are calling it the 8 antenatal contacts. We are encouraging all mothers to complete 8 visits. That will be accomplished if they start the antenatal clinic below 12 weeks. So we teach them to recognize the pregnancy signs and symptoms early so that they immediately start the ANC.
Exactly.
And we are also able to identify most of these complications early enough. Yeah, so pregnancy is not as simple as people think.
Okay.
Yes.
I mentioned I wanted to get it clearly. I thought I was a little bit mad, or with lack of a better word to use, because I don't understand how pregnancy was given a definition of normal occurrence, because pregnancy itself, it's way crazy.
Yes.
You would I've seen mothers where a mother walks in very normal, very okay, to antenatal care, and complications happen during the time you are having, taking history and having conversations, and you've even planned her to come after maybe 3 weeks or 2 weeks or 1 month. During the period of time in between her waiting for the rider or the Uber guy, in between the period of time, she starts complaining of, backache. It's leading to lower abdominal pains and everything else. Within a shorter period of time, you're seeing waters breaking, or rather blood flowing. In between the 2 minutes, whatever you're planning for ultrasound, you notice that the mother is mentioning that I'm getting the urge to bear down. Hata kabla ufike the labor room, you have the baby.
Yes.
Possibly a premature baby. And it tells you that all these can happen within a very short period of time. That alone, you will be having a mother, maybe in an MCH and all that, and you tend to have conversations with the mother. Through the conversations, a mother will start conversing. Or I don't know if it has happened.
Yes.
Someday. Coming to do the function test, the kidney function test and everything else, you notice that this mother has been having high blood pressures, unnoticeable high blood pressures. Possibly you notice the blood pressures that very same day, and you've given something to see if with the second blood pressure take or the third one, you will be achieving. Before even you take the second take, you check the second one or the third one, the mother is convulsing.
Yeah.
So I don't really think pregnancy is an easy thing.
It is not easy.
Exactly.
And now most of these predicaments are you cannot anticipate.
Yeah.
And at times the high BP will occur even during the third trimester.
True.
At times it occurs in labor.
Yeah.
She will
very
start.
true.
Yeah, she will start her labor well contractions. Then she mild. Then she's approaching. Even before she approaches second stage, she starts conversing.
She starts convulsing.
And there is no history ever
Wow.
of a blood pressure.
Wow.
So that's why I'm saying there's a lot of science involved in it. Because if you read more about blood pressure in pregnancy, what we call preeclampsia, and escalates to eclampsia if care is not taken, or if it does not respond
within,
it is idiopathic.
Yeah.
Now some scientists think that it is the placenta that has the problem. Others think that it was the spermatozoa that had something, because a woman is well until you get pregnant. You get married and get pregnant.
Yeah.
And then everything starts changing.
Okay.
But I would like to know if the researchers have advanced in their research on preeclampsia.
Okay.
Yes, because if we know the cause, then it will be very easy for us.
Yeah.
We are trying very much to introduce the preconception care package to our mothers. But now you find that in our let me say Kenyan setup, number one, we don't have wellness clinics, especially in the government setup. Isn't it? We don't have.
And if there are some, they are very expensive.
The private ones are expensive, and
Private,
and actually corporates don't cover such.
Yeah.
Now, if we can have the wellness clinics in our level 3s, level 2s, and even level 4s, and in case of complications, they refer now to the level 5s, I think we can be in a better position to curb most of these complications in time.
Okay.
Yeah?
Okay.
Because actually, hypertension in pregnancy and diabetes, there's something wrong somewhere.
Very true.
Something very wrong.
Very true.
we found out from our clinic here
Mm-hmm.
that when we said mothers for the simple routine random blood sugar, well, we are getting mothers who have gestational. They don't know, they have no history, there is no family history.
Mm-hmm.
And when we follow them up, you find that they actually turn to be diabetic.
Diabetic.
Yeah?
Okay.
So researches should be on a higher level in Kenya, especially on those two conditions.
Uh-huh.
Yes.
Fine. You brought up something. Wellness clinics.
Yes.
In our level 2, 3, and 4s.
Yes.
And I noticed you excluded level 5 and 6. Now, you're clearly mentioning about preventive care.
Yes.
Would you say that preventive care from the government setups, hospitals, we have achieved at least to 50%?
Well, I wouldn't say.
Mm-hmm.
I wouldn't say we have covered enough.
Mm-hmm.
We are at that number.
Okay.
Because even our people have, they don't seek these services.
Yeah.
Unless there's a problem.
Unless there's a problem.
Number one, we don't have the time.
Yeah.
No, we are a very industrious nation.
Mm-hmm.
We don't have the time,
Mm-hmm.
and we don't have the money.
Okay.
Because it will be cost effective.
Very true.
Yeah?
Yeah.
And also we lack the understanding. Why should I queue in
Why
a
should
hospital
I just walk into
and
a
I'm
clinic?
not sick?
Yeah, exactly.
Now, going to tell the doctor I want to get pregnant, even that doctor might abuse me.
Yeah.
You know,
Yeah.
that is the perception.
Very true.
But if we can even have health talks, regular health talks, and even in our social medias, we try to advance this health talk on preconception care.
Yeah.
We can at least curb a percentage of these problems. We can get them on time.
On time.
Yes.
Exactly.
Yeah.
We have very young viewers, female and male, from ages 18, 19 to up to almost 30 years of age. And you see, during that period of time, let me exclude 18, 19, and at least up to 21. But from 22, it's when most of the ladies are planning on how they are getting someone they can have a long-term conversation, and during a long-term conversation, it's when now things happen. Pregnancy kicks in.
Yes.
Right? And we have been trying to have conversations around healthcare, trying to talk to our viewers each and every day, to mention to them why they need to visit clinic as early as they notice that they are pregnant or they've conceived. Okay, what would you tell a lady who possibly didn't get her menstrual period this month, and possibly she's worried, possibly she has the thoughts of getting done away with the morula and all that?
Yeah.
What would you mention to them out there?
Now, first and foremost, to the young generation, we are saying we have problems with too many cancer conditions striking in at early ages.
Yeah.
So we are encouraging them or advising them to delay sex before the age of 21, so that the cervix will have grown. Yeah?
Yeah.
Because we know cervical cancer is a sexually transmitted infection. Now, and also they will have matured. We know that the long bone, the head plate of the long bone, matures from the age of 24, 25.
Yeah.
Yeah?
Yeah.
So the body needs to mature up before you carry a pregnancy.
Exactly.
And that will reduce one big part of preeclampsia due to too early stage of life.
Yeah.
Yeah. Another thing, they will also have grown, matured mentally to withstand a pregnancy.
Exactly.
And also to cope well,
Yeah.
both of them.
Exactly.
Now, if one misses her menses, we need to find out if it's a pregnancy.
Exactly.
Because missing your menses doesn't mean you are pregnant.
Very true.
Now, is she on a contraceptive method? Number 2, is she on other medications? Because there are some drugs you can be on that can interfere with the menses.
Very true.
Then we need to find out if she was not on a contraception, if she's not on any medication, and she had unprotected sex, of course, we need to have the test done. Missing a period doesn't mean you conceived.
Very true.
We need to know, is there a mass in the uterus, in the ovaries, that can produce the same hormone like the pregnancy? The placenta, the human chorionic gonadotrophic hormone.
Gonadotrophic hormone, yeah.
So starting your ANC as early as that time you have missed your first menses.
It's very necessary.
So when they come to the clinic, give us the history, and then we act accordingly. We need to do a PDT. We need to do a ultrasound, because a PDT may be positive and there is no pregnancy. It's a tumor, it's a mass, it's a cyst. Yeah.
Hormonal imbalance.
Yes.
Yeah.
And again, we need to know early enough. Below 12 weeks, we are looking at the viability of this pregnancy. Is it well implanted?
Okay.
Do we have, is there subchorionic bleed? Is there a problem suggesting a threatened abortion? Could we be having an ectopic pregnancy? So all these have to be analyzed early, and some of them, if not analyzed, they are life-threatening.
Okay.
Yes.
Nice.
So that is what we are saying. If we can have regular health talks on preconception care, it can really help.
Okay.
Yes.
Thank you so much. Thank
Yeah.
you. One, you mentioned that your parent walked in. I'll take you back again. You mentioned that your parent walked in with a letter and mentioning that you have to go to Mutumo,
Mutumo Mission
Mission Hospital. And then you accepted. And after accepting, you have practiced for this whole period of time. I will try and get it from you clearly, from where you sit, because there are students. I've met several students having conversations that I didn't like this, practicing nursing. I didn't want to come to a nursing school. Myself, it took me over 4 months, 5 months to accept that I was in a nursing school, and I couldn't go back to my home, keeping in mind that my mom had really hustled out to make sure that I'm in that school. And then, crazily enough, I noticed that I was in a nursing school when I was told that there was a Block 1 examination coming. And now I had to become serious, because exams means a lot to me. I wouldn't want to be, given receipts and all that. So I decided to start studying. Maybe hard. Let me say hard, not smart, because I was trying to grasp everything here and there. I know it's from a personal perspective. For someone to become a nurse, being a nurse, it's not an easy thing.
It is not.
And for someone out there, I know you might be having 1 or 2 words that will change their mentality in a different way. We're not saying that they must be nurses. Clearly, they would end up maybe becoming business people. They will go work in entrepreneurial companies and everything else. But for someone who wants to be a nurse, but they don't understand how they are going to hold on to this career, they feel that it's a crazy career. What do you have to tell them?
Now, I've said I've transitioned from several generations.
Yes.
During our time, we didn't know how to argue with parents. There was no that provision.
Exactly.
Yeah. And like me, I can say I was lucky or unlucky. I don't know which one to use. My parents were teachers.
That's lucky. Being lucky because they understood
Yeah, but
some bit of
they
things.
did not listen to me to become a designer. Yeah, what we need to understand these days, don't force anybody to do what they don't want to do.
Okay.
Those that don't want to go to a nursing school, don't let them go. I have seen students here from various universities. She has a degree in IT, and they are doing nursing now because that was their passion.
Exactly.
Even parents don't know they're in school once again.
Exactly.
So we are wasting their time.
Yeah.
Especially the mothers. I'm a Gen X. Wazamani wanaitwaje? Baby boomers.
Boomers and millennials.
Now, what I have clearly understood, passion and what else? Something we are passionate about is very different from something that somebody else wants you to do.
Mm-hmm.
My daughter is a DJ.
Oh. Ah.
And taking her to a DJ school, it took several people to convince me. Because to me, that was waste of my money. Hiyo ni kazi gani jameni? And I was like, my daughter aende na naona kama DJ wanaenda ka club usiku.
Hapana. And is a lady.
Yes.
Yeah.
I was like, now as a mother, I'm now setting my no. But my sister had to talk to me, and even she told me I would take her to a school where my colleague has an academy. Who is actually a lecturer.
Okay.
And he has an academy.
Okay.
And she went.
What is her DJing name?
DJ A.
DJ A.
Yes.
Clearly that
She's
is
in those media
houses.
Yes.
Okay, fine. Fine. I will try check if she has mix music videos out there.
Yeah, she has.
Okay.
You will see.
Yeah.
Now, what I came to learn from her, passion can take you far.
Exactly.
I've seen her win several awards.
Oh.
Best DJ in Nairobi. And I was like, hii Nairobi. Mtoto wangu. Bali kunaendanga aje. So I've come to respect that as her career.
Okay.
And I support her very much where necessary.
You listen to the mixes she make?
Yeah, I like music of the 80s,
okay.
70s.
Uh-huh.
Yes.
Nice.
And I would urge parents, let's not waste time for this, our children.
Okay.
Atasoma hiyo yako ulimtuma, atarudi yake.
Yes. Very true.
Yeah, it is happening. We have them here. Quite a number. A lawyer. I had a lawyer.
Mm-hmm.
Yeah, she was a student here.
Ah.
And her passion was nursing.
Nursing.
Yes.
And she's doing well.
Yeah.
Fine. We've hosted a nurse here who was just transitioning to her graduation. I think that was in November. December. They were graduating in December. The one that was at Kasarani.
Okay.
And she had done criminology throughout the whole school. And now she decided to go back to school. She decided to go back and take nursing again.
Yes.
Because that was her passion.
Yeah.
And I understand clearly what you mentioned, that if someone has to meet their passion, let them follow their
heart.
Yeah. Because that has been the problem in our setup right now. Because you'll notice that there are students who come in and they are not really interested in whatever you're teaching them.
Yeah,
they're not really
sure.
interested. And you can't blame them that they are not interested. You should get the root cause of everything. Possibly the parent mentioned to them that you have to go to a medical school.
Yeah.
You have to go do nursing, or you have to go do medicine for the family to get a name.
Yeah.
Right? But at least I should thank you as a parent that you eventually was convinced. to allow your daughter go, pursue her DJing. And now there she is. I believe she's grateful.
Yeah, she is.
Nice.
And she loves what she does.
Okay.
Yes.
Fine. How is it like transitioning now from uniform to home? How do you feel about it? Is it emotional? Is it too much that you're used to seeing different clans each and every single day? Possibly having your offs on weekends only, and weekends you to church, or rather meeting the family and everything else. And now you have to wake up and figure out on what you're going to do.
Well, there's something we learned in psychology.
Okay.
There's a psychologist by the name Eric Erickson.
Mm-hmm.
You remember the developmental stages?
Yes, sure.
Now, those developmental stages come to pass one by one.
Mm-hmm.
And you cannot skip any. Yeah?
Okay.
If you analyze them one by one.
Mm-hmm.
And if you skip one, you'll find yourself going back.
Mm-hmm.
So where I have reached now,
Yeah.
I've come to realize that I'm thinking more about what I'm doing at home than what is happening in Pumwani.
You're preparing.
Yeah. I'm preparing, and it is automatic.
Yeah.
It is automatic.
Uh-huh.
So I am now relating to the environment within my homestead. Yes.
Okay.
But, once a nurse, always a nurse. Consultations here and there. And I know I will have few things to do.
Yeah.
Yes.
Exactly.
Yes.
You'll surely have more things to do.
I will.
Yeah. That's so interesting.
Yes.
I'm so intrigued with the conversations we are having, because there's this video you shared with me.
Yes.
Continuum of care.
Yeah.
And throughout your period of time of practice, you've done more and more, because you mentioned that there are times there was only one Doppler in the hospital.
Yeah.
And possibly other hospitals never had a Doppler.
No, others, especially the government,
Especially the government.
Yeah.
Yeah.
Mm.
And right now, back in the times, there was never any period of time someone would have a conversation around health easily.
Yeah.
And that turns it to, limitation, a little bit limitation around healthcare, because you couldn't tell a story. Telling a story itself would feel, it's like you're ripping off someone's, dignity.
Yeah.
But right now, when I was watching the documentary you guys did, under the continuum of care, I was seeing you elaborating things, and the narrator elaborating step by step. There was PS Health, PS Oluga. There was our president as well,
Yes.
William Samoei, and there was our CS Health, Adan Duale.
Yeah.
Narrating and walking to their offices to as well give energy to this very same documentary. And with the documentary, you're trying to elaborate more to people out there. How is it for you, or how has it been for you, keeping in mind there were phases that you really developed everything through books, and now there's this phase that you have the audio visual narration and educating and everything else. How has it been for you to transition from this phase to this phase?
Now, number one, I would thank the advance in technology. And things have changed.
Yeah.
We are also enlightened.
Oh.
And we've come to know that we need to own whatever we are doing.
Exactly.
Especially the health services.
Yeah.
And now people are outspoken.
Yeah.
We now know our rights.
Mm-hmm.
Yeah?
Yeah.
As health workers. patients have their rights as well.
Very true.
And they can be discussed and communicated across the board.
Okay.
Now, we can also through researches we have done, researches here and there, we know what has changed, what needs to change.
Yeah.
We can give our views. When we do our reports, like you do your monthly report, like what we are preparing in MCH for last month, that report, you analyze it well, and you can see the gaps.
Okay.
Now, it is through those gaps that you develop.
Very true.
What you are, the next step.
The next step, yes.
It is these gaps that we even develop policies from.
Yeah.
We also see where we need help. And ask for help.
Yeah.
So I can say the way things have advanced, and even in fact even the education, it has really helped to be where we are.
It surely has.
Yes.
Okay.
We cannot compare even management of a pregnant woman those days in our trainings to today. Yeah?
Yeah.
These days mothers have antenatal booklet, she can read.
She can. Very sure.
Before then you tell them.
Yeah.
You tell, and then we thought that the clients need, or the patients need to be told, they are not telling.
Yeah.
But we manage. We discuss management with them. It is them we are managing, isn't it?
They understand themselves better than you.
Yes, we teach them about their condition, diabetics. Teach them about this disease. She's or his treatment number one himself. Yeah?
Yeah.
Then equip them with knowledge.
Yeah.
Clear well the do's and the don'ts.
Yeah.
And make a management plan with them.
Okay.
When she's able to come to the clinic, how to take drugs. These days we even have telemedicine.
Very
she
true.
can call.
Yeah.
You can even call to find out. Yes.
So clearly it has worked out well for you, and
yes,
has eased the workload. Huh?
Exactly.
Very nice. I understand that during your period of time there were chances to go outside the country. Right now there's plenty of conversations, plenty of companies, or a lot of them out here training nurses to go outside the country and practice outside the country. Is it advantageous if you are asked, or would you advise someone to practice in Kenya more than going abroad?
Now, going abroad, number one, socioeconomic status. That is the leading cause.
Very true.
Yeah?
Yeah.
Number two, job satisfaction. Yeah? I wouldn't say security, because east-west home is always best.
Home is always best.
And also, it's good to venture out and find out what happens there.
Exactly.
Yeah. But being home is also okay. It's good. It's home good. After all.
Okay.
Yes.
Nice.
But if there's a chance to go out there, venture out, get some money, we go there because of money, nothing else.
Of course.
And trying to get new techniques, new technologies.
Yeah.
And in Kenya, our education is of high level.
Yeah.
And our nurses are very well equipped and very sharp.
Yeah.
And our education matches most of the education out there.
Yeah.
So even when we go there, we are not lost.
Yeah.
So that is one advantage. Yes.
Nice.
Yeah.
So there's this company that really supported this episode. And I just want to mention to people out there that they should train in IELTS. And they supported this episode. Clearly they are called Next Gen. Next Gen.
Next Gen.
Yes, Next Gen. Your trusted partner on the journey to becoming a US registered nurse.
Okay.
Yeah, and some of the services they do, they train NCLEX, IELTS training, and they give an NCLEX agency. They link you up to their poster will be here. they will link you up to better job opportunities or advise you clearly throughout that route. I know during your period of time, you guys never had someone who would walk out here and decide to be a trainer throughout the process, taking someone from minute one to the last minute when they are taking their flight outside the country. And we are advising young generations, because in the country right now we are not getting jobs. It's so hard, unlike during your period of time when you would be employed because chief alichukua jina yako akaenda na ama a certain walikuwa naitwa ward administrator ama walikuwa naitwa aje?
Yes, and clerical officers.
And clerical officers. Yes. Amechukua mtoto wa nani hapa anafanya nursing. Anachukua jina, anaenda nayo na anapeana na mtoto anapewa shule. Saa hizi unaweza kuwa unawajua, lakini ni nini uko nayo? Uko na how much ya kutupatia. So we're advising people, instead of using your 300,000, 400,000 to get a job in Kenya, clearly you can use your money and go explore out there, and you will come back at least when your pocket is a little bit full, right? Yeah. But actually, as well, east or west?
Home is always now, okay, fine. During our time, life was very good and okay. 91, when we were being employed, 90, 89, life was very smooth. I normally tell my colleague here, I could afford a Nation newspaper on Sunday, a Standard newspaper, the same day. And on Saturday, I would be having a weekly review. That time, I love reading. Yeah, you have the three. Okay, television was limited. It didn't have a lot. I would stock Milo, cocoa, and tea bags. But life was smooth.
Okay.
And not very expensive.
Sure.
I remember I used to take my clothes to the dry cleaner. You know, that life, until you people came and spoiled everything. So, since we became contented with wherever we were working, like I joined Nairobi City Council when I was still young. Yeah. So I think we went into a comfort zone and moved on.
I should ask you one last question. What was, I know your salary has changed all along this period of time. What was your first salary ever?
My first salary ever when I was employed was 2,500 shillings.
Oh. In a private sector or a public?
No, in the city council.
2,000?
2,500.
A whole month?
A whole month.
Okay.
Yes.
And this will sort everything out?
Yeah, everything. I used to pay 5 bob from where I was staying to the hospital I was posted to.
Okay.
Yes.
That's enough. That's enough for now.
Nation newspaper was 1 bob, 151 shilling and 50
cents.
Yes.
Nation newspaper.
Yes.
Okay.
Yeah.
Now I understand. At least, when you're having 30 shillings, you have, around 40 shillings, you have newspaper for the whole month.
Yeah, and you have money. You have money when you have even 200 bob.
Okay. Yes. Okay, fine. 2,500 shillings is what a nurse gets right now for a 12-hour shift. That is in better setup facilities. And
in today's currency.
Yes. And there are some that will pay up to 4,000. There are some that pay 1,000 shillings. Yeah. Of which we are not advising them to be paying 1,000 shillings. They should be paying at least 3,500 and upwards, because there are a lot of things in today's currency.
Yeah.
Yes. Thank you.
Yeah.
I want you to wrap up this episode. Before I give you my last words. I want you to wrap up this episode, telling a nurse out there, or rather wishing a nurse out there a happy Nurses Week.
Okay.
Yes.
To my fellow nurses, I wish you all the best, and love what you do and do it well. at the end of it, God rewards us. Yes.
Exactly. Nice. Thank you so much for being on this episode.
Yes.
There's a message here for you, okay?
Yeah.
And clearly, 34 years later,
Yeah.
the uniform may come off,
Yes.
okay?
Yes.
But the impact remains.
Yeah.
Thank you for everything you poured into this profession. Your story doesn't end here.
Yeah.
It lives on in others.
Yeah.
Okay?
Yes.
Feel loved, feel cared for, and we appreciate you as the Corridors Podcast.
Thank you very much. I'm privileged.
You're welcome.
And I told you I love poems, eh?
Yes.
And I don't struggle much to write a poem.
Okay.
I don't know if it is in me, eh?
Mm-hmm.
So, being a nurse started a long time. And the long time is not ending anytime soon.
Wow.
I carry my profession all along, all the days that God is going to give me. I love, I care, I cherish, and I can touch hearts. So God, I pray, give me more days and give me more grace, and I'll thank you each and every day. Long live nurses.
Nurses power.
Nurses power. Nurses TB.
Long live nurses.
Long live
This was
nurses.
your host, Dante, and clearly, I know you've really loved this episode. If you've watched until this last minute, you understand why experience and maturity in a profession means. Thank you so much, Nurse Kahara.
Karibu sana.
Sawa,
I'm
sawa.
grateful.
And that is the end of our conversation today.
Thank you.
You're welcome. Peace out.